What up, everybody? It's your boy Doc Maham over here, and welcome to another episode of 3 Docs Teaching with your boy Doc Maham. I am the third doc. I haven't introduced myself. Hopefully, I can bring you some value, and hopefully, we can have some fun over here. Anyways, so let's start off with this problem-based question over here. I'm going to read out this question. A newborn baby delivered at 40 weeks gestation by spontaneous vaginal delivery is brought to the clinic due to the presence of small white or yellowish bumps on face. The baby's temperature is 98.6 degrees Fahrenheit, pulse is 130 per minute, and respiration is 40 per minute. Physical examination shows multiple 1 to 2 millimeter white or yellowish papules on the nose, cheeks, and forehead, which are non-tender and not associated with erythema. The mother reports that the baby is exclusively breastfed and takes no medication. What is the appropriate management of this condition? A. Condition is self-limited and resolves spontaneously. B. Oral antibiotics. C. Topical corticosteroids. D. Incision and drainage of the lesion. Now, approaching this question, let's just point out a couple things that we need to really focus on, really. Number one, this is a newborn babies. Time and onset should already give you a lot of information. So for every question, you should look at the time and onset of something, or the age of your patient. That itself gives you many clues. 40 weeks gestation by spontaneous vaginal delivery, so it seemed like this patient was delivered normally. Brought to the clinic due to presence of these clinical findings: small white or yellowish bumps on face. So these are the clinical findings that we need to focus on. The baby's temperature is 98.6 Fahrenheit, pulse is 130 per minute, respiration is 40 per minute. Physical examination shows multiple 1 to 2 millimeter whitish or white or yellowish papules. So the vitals seem to be normal, but we do see this specific finding over here. And then you see it where? On the nose, cheeks, and forehead. So nowhere around the body in any fashion. It's non-tender. It's not associated with erythema. So there's no erythema. The mother reports that the baby is exclusively breastfed and takes no medication. What is the appropriate management of this question? Now pause and try to solve this question. I'll give you like 2 seconds. Anyways, we're back, and the answer is condition is self-limited and resolves spontaneously. What is this condition is the question. This condition is actually a condition called melia. When we look at neonatal rashes, we need to classify. We have 5 specific neonatal rashes that we need to be concerned about, right? One is milia. Milia is a finding which is found on the baby's face, and it has firm white papules on the face. So as you can see, this is a baby. He's got some white pimples on his face, and there's no body made, which means that you need to focus on the white pimples or papules on his face. There's neonatal pustular melanosis. This is a condition where you have pustules that turn into brown macules and can involve palms and soles specifically. So over here you have a baby. He's got some pustule-like findings over here, and at the same time he's got some brown pustules macules over here, and then you can see that the palms and soles of this baby is involved quite a lot. The next condition that you need to think about is erythema toxicum neonatorum. Erythematous pustules on the trunk and proximal limbs. So you can see this baby's face is completely clear. There's nothing on this baby's face, but what you do need to see is this baby's trunk, this baby's body, and upper limb specifically. He's got some erythematous pustules. The next condition we need to talk about is neonatal cephalic pustulosis. This is erythematous papules and pustules on face and scalp. So this condition specifically, it's red and yellow because you have both red papules and yellow pustules. We're using yellow to signify pus. And then finally you have malaria rubra. This is rash on intertriginous or fold area. So you can see that in this baby specifically, you find these rashes on the fold areas. I'm marking these over here. Another thing that I want to point out is that this condition is specifically seen in babies that are overbundled or have tight onesies on, or they just have excessive clothing, and that is specifically, I guess you could say, a breeding ground for the rash. And it's not necessary that you only see it in these intertriginous folds. You may also see it on the body at times, as long as the baby has been wrapped or over bundled when they were born. So obviously there's a lot of clinical findings. So what is an easy way? What goes in my mind when I'm thinking of these rashes? How am I logistically thinking about it? Well, here's basically somewhat of a diagram or a mind map that I came up with personally to remember these neonatal rashes. So the first thing is I want to classify everything based on the time and the features. So we already talked about the features, but the time, in all honesty, is probably the most important thing about these questions. If we look at this chart over here, I made birth, 3 days, 3 weeks, and any age except birth. I've classified the diseases based on time. There are 3 diseases that you can see during birth. You have erythema toxicum neonatorum, you have milia, and you have neonatal pustular melanosis over here, right? And just to make it easier, I've put all the babies' faces as well. So during birth, right here, you see 3 specific diseases. Now, erythema toxicum neonatorum can appear either at birth to 3 days. So you can see it in between birth to 3 days. And so you want to distinguish this specific condition based off the clinical findings, which you'll see are erythematous, pustules essentially. Specifically on the proximal limbs or upper body, right? Neonatal cephalic pustulosis is a condition, right, where you'll see, erythematous pimples and then pustules as well, but you'll see it specifically at 3 weeks. So again, we're classifying based on time and we're classifying based on features. And last but not least, we have malaria rubra, right? This specific condition you can see at any age except birth. Now, to make things pop in your mind, I drew a baby with clothes over here, right? And what we talked about was that malaria rubra is basically caused by, the basic cause is, over bundling of the patient, tight clothing. And essentially, after, you remove that tight clothing, you see these rashes on the babies. It could be on the intratriginous folds. It could be on the trunk of the baby. You could see it in a question where they say this baby was over bundled and there was, and you see a rash and you realize, oh, that rash is basically due to tight clothes, So here I made this nice cute baby over here, and then I made arrows for management, right? So management is green. So the management for malaria rubra is you just remove these clothes and you have this, free-flowing baby, and he'll be fine spontaneously in a couple of days. All these conditions, you will be fine, you will be cured spontaneously and in a couple of days. That's how these neonatal rashes work, and that's how the question usually goes, except malaria rubra, where you have to remove the clothing or the overbundling of the baby, and essentially you end up curing the baby later on. So over here on all these, I wrote O for observation, which means that you don't do much, you don't treat anything, you just observe the patient. And so this is the mind map that I've come up with. So again, you want to classify based on time and features, and you want to classify, you want to look at the time. There are 3 conditions that are at birth, 1 condition is at 3 weeks, and 1 condition is at any age except birth. And usually there's a finding of many clothes over here. So here's just a overall idea of this mind map over here. It's easy to see. Just wanted to make it easy to see so you guys can see exactly what's going on in one piece, right? So if we go back to the question, right? A newborn baby delivered at 40 weeks gestation by spontaneous vaginal delivery. So this is a newborn baby. Start off with there. So this condition is based off birth. Is brought to the clinic due to the presence of small white or yellowish bumps on the face, right? So we talked about white bumps on the face, and that seems to be milia, right? You may be confused by yellowish bumps on the face as well. Let's keep reading. The baby's patient temperature is 98.6, so the temperature seems to be normal, so there doesn't seem to be any infection. pulse is 130, respiration is 40, physical examination shows multiple 1 to 2 millimeter white or yellowish papules. The vitals seem fine. Again, it keeps talking about white or yellowish papules, specifically on the nose, cheeks, and forehead, meaning specifically on the face. You don't see it on the trunk in any fashion, right? The condition is non-tender and not associated with erythema. So all the erythematous papules that you thought of, you can cancel that out of your head. The mother reports that the baby is exclusively breastfed and takes no medication. What is the appropriate management of this condition? It's pretty simple. The condition is self-limited and resolves spontaneously. You don't want to give oral antibiotics because, there doesn't seem to be any, fever. And the same with incision and drainage. There doesn't seem to be any specific fever that this baby is going through. And this isn't an autoimmune condition. So, so you don't want to use corticosteroids. And again, here's an overview of all these babies over here. In case you're confused about the specific condition and how to treat it, just know that most of these conditions, they are just solved by observation. And there you have it. So thank you so much, guys. Thanks for watching. Hope I can bring some value to you, and hope I can continue teaching you guys and bringing you value and teaching different things. If you like this video, please like this video and subscribe, and see you